Okay, the sixth claim that is made by a lot of these democratic socialist advocates is that socialism works in medicine. This is their other big one, is that America's system of healthcare sucks, and if you go to some of these socialized medicine states, that even if you don't claim that Canada is a socialist country, they have a socialized medicine system, and it works better than our system. So first of all, it is important to note that the United States system of medicine is not actually a free market system. The American system of medicine is deeply, deeply regulated, heavily, heavily regulated. As some of you may know, my wife works in this industry. Okay, it is... Government programs have exacerbated this problem in many ways. Medicare has low rates of reimbursement, high levels of paperwork. More and more doctors are opting out of Medicare, which means that they are upcharging other customers in order to make up for that lost time. That is raising prices. The fact that there is no transparency between your insurance company and you is a real problem. No one in this room could probably get a straight answer if you walked into your doctor's office and said, I want an x-ray, how much does it cost? You literally cannot get a straight answer, because it has to run through your employer's insurance, and then that insurance has to bargain with the doctor, so the doctor can't actually give you a straight answer. That is not a market system. A market system is you go to the grocery store and you know how much a can of beans costs, right? Any free market system involves a price that you know as a customer, and that then you can use in order to decide whether or not to purchase the product. This does not hold in medicine. In medicine, you go in, they prescribe you something, and then you have to run around with the insurance companies and try to figure that out. That's because of overregulation. It's also because of a system of employer insurance that doesn't exist in other countries. It's a really stupid system, and it was created specifically because of government intervention in the first place. In the 1950s, there was wage control in the United States, and employers decided that in order to avoid wage control, they wanted to give their employees raises, they would actually provide their health insurance instead. They couldn't give them raises in monetary form, so instead they basically made an in-kind contribution, and they said, we'll buy your health insurance for you. What's incredibly stupid about this, of course, is that if you lose your job, you lose your health insurance. No other country has it like this. Right? Switzerland, which probably has, for my money, the best government-involved healthcare system, essentially has an individual mandate, but no employers, right? And employers aren't responsible. You buy the insurance yourself, and then it is your job to pay for that insurance, and the government penalizes you if you don't buy the insurance. So that is if you're going to have a government-involved system, that is what looks like the best system, not the systems of the UK or Canada. But there's no reason that we even have to do that, because it is true that the United States system is not a free market system in the first place. So when people say socialized medicine works because look how America is failing, the answer is America is not a free market system. America is not even close to a free market system. Now, America is still the best place to go in the world if you have money. Right? If you haven't, that's why everybody comes here for surgery. You don't have to wait in line. The vast majority of actual medical innovation is done in the United States. 44% of all new molecular entities, essentially drugs, are created in the United States. And the fact is that virtually all medical innovation truly is driven by the United States, because we are not a government that bargains with drug companies. We're not a government that bargains with surgeons. And so what that means is that we pay a premium. Right? We're actually paying the actual free market price for medical care, and then all these other socialized medicine countries are basically jumping on the back of what we pay. So we're paying more so that other countries get to pay less, basically, because we don't collectively bargain against all of these medical innovators. So healthcare is a little more complicated than they want to make it out to be with regard to nationalized healthcare.